thanks again for being with us today. Barb, if we could advance to the next slide. It is August 5th today, and we are relaunching Community Circles, which is a partnership with Central Iowa Funders Forum and a great group of funders and partners who really are here to support and help the nonprofit sector have that leadership role in the community that's so critical. So I just wanted to kind of set the stage for our community circles by highlighting the goals of this series. So we seek to build trusting relationships and share knowledge and resources with the Central Iowa nonprofit sector. Our expectations for these sessions are that participants center our dialogue around these common goals and remain rooted in equity and inclusion. And then just a note of housekeeping, if you could, in this first half, unless you are a presenter, turn off your video and mute yourself if possible. And then we will invite you all to turn on your videos and come off of mute for the second half during our breakout sessions. So let's go on to the next slide here. And I have our agenda for our August 5th presentation today, which will be first, it's really about return to learn. So we're going to approach this from a couple of different angles. First, we're going to have Sue Schwartz, who is joining us from Oasis, talk a little bit about the Family First Coronavirus Response Act and the implications that that policy has on return to learn as the nonprofit workforce. And then we'll get some local updates from Kate Bennett and Cheryl Werner of United Way's education team. And then when we head to the breakouts, we'll have two different opportunities. One will be to talk about how Return to Learn might be impacting your programming as an organization. And in the second room, we'll talk about Return to Learn and how it might be impacting your workforce as an employer. We'll also have Dave Stone from United Way in the main room, which will be recorded, talking about advocacy updates and needs there for the sector. So I would like to welcome Sue. I think I see Sue there, and she's actually joining us from Colorado, I believe. So Sue is connecting to audio right now, it looks like. Sue, good morning.
Good morning. Sorry about that.
No, you're just fine. Do you mind can you tilt down a little bit? Oh, there you go. We can see you now.
Are we good now?
Yeah, and then I'm just going to, okay, I apologize if I have to mute anybody else, but if you need me to unmute you later, let me know. But we're just going to try and keep everybody else on mute and videos off so we can focus on you, Sue, and what you're about to share with us. So we invited you really today to give a highlight. You know, we've heard that the sector is challenged with Return to Learn in a couple of different ways. And one is just navigating how employers can respond in this time, knowing we have many who are in a direct care workforce kind of role, and there are many different needs. So Sue, I'll give you the opportunity to share your screen if you like, and Barb, you might have to stop screen sharing so that Sue can share her screen. Did you want to pull up that that kind of highlight, or do you want to just keep this open and we can
Let's just keep it open for now, and okay. I can definitely share that information with you, and you can share it with the group
afterwards. Perfect.
Afterwards, yeah.
That sounds great. Well, Sue, sounds good. We'll keep this slide up. Wonderful. And great. I just wanted to invite those who are joining us today to ask questions in the chat if you have questions for Sue. But we'll be trying to keep this to 5 or 7 minutes. Go ahead, Sue.
I'll talk as fast as I can. So,
sure.
All right. My name is Sue Schwartz, and I'm a compliance analyst with Oasis, a Paychex company. And I'm here just to kind of chat a little bit about the Families First Coronavirus Response Act, or the FFCRA. And just 5 kind of things that you need to know or think about as children return back to school. So I'm referencing in this, when you see the handout, I'm going to be referencing the FFCRA the Employee Paid Leave Rights Act poster, as well as the question and answers that the DOL has put out, in addition to the IRS COVID-19 tax credit FAQs. So you can find this information detailed in those different references. So I'm just going to quickly first talk about the FFCRA and remind you that it requires employers to provide 2 weeks or up to 80 hours of emergency paid sick leave, or EPSL, and up to 10 weeks of paid expanded family and medical leave, or EFML. So this applies to all employers, including nonprofits, who have fewer than 500 employees. So there are a few exemptions for certain industries, but in the most part, all employers under 500 are required to provide these 2 benefits. Employers under 50 employees may exempt themselves from this requirement to offer the expanded family medical leave, and one reason for the paid sick leave, and that is related to the school or child care closures. But they can only exempt themselves when these requests would jeopardize the validity of the business. So the paid sick leave must still be offered for the other remaining 5 reasons that it's required for, and to exempt your business from this, you must meet one of 3 requirements. And these are outlined in those FAQs offered by the DOL, and you can read more about that there. An authorized officer of the company must make that determination and document it, and recommended that they just notify employees that they're exempting themselves from that, just to avoid questions. So the second point we're going to talk about, and this is probably the one everybody's most interested in, is the availability of the EPSL and the EFML as it relates to school and child care closures. So as we sit here in summer vacations, or other reasons why your daycare provider or school might be closed, do not qualify an employee to take leave under the EFML. Because that's not a reason listed. But as schools start to open, we're going to look at different ways that schools are opening. So I know around here in Denver, where I live, many of the school districts are starting school remotely. So there'll be no in-person learning. And in that case, the employee would qualify for ESML if they needed to care for their child. In the case where school districts are offering a choice between in-person learning or remote learning, in those cases, the employee would not be eligible for ESML because, again, they have a choice for in-learning, and so it doesn't qualify. And then there's a third option that a lot of schools are offering, and that is a hybrid model. And that hybrid model is they might be in school 2 days a week and remote 3 days a week. And in those cases, the employee would be eligible for the time that the student is remote learning if they needed to care for them. So in those cases, it would be considered intermittent leave. So intermittent leave for ESML purposes is allowed when the employee and the employer agree to this schedule. However, just earlier this week, there was a court case that was settled out of New York that challenged this, and it looks like the employer no longer can agree or has to agree to the situation. So I would keep your eye out on that if you are offering that to employees. So intermittent leave can be allowed when an employee works from home. So in that case, it might be that they need 2 or 3 hours during the day to help their child, or it might be that they're at the work site and they need the full day off on those days that the child is not in school. So the third point that I want to address is how the expanded family medical leave coordinates with our FMLA. So employers over 50 who already offer FMLA, the expanded family medical leave requires a total of 12 weeks of leave. The first 2 weeks of that leave is considered unpaid, and the remaining 10 weeks is considered paid leave, which differs from regular FMLA. So employees may choose to use the 2 weeks of paid sick leave that they have available to them during that time. So that's how the first 2 weeks would be paid, but they're not required to do that. Any previous FMLA that they've taken, or if they, in the springtime when schools were closed, if they took any EFML at that point, though that time all counts towards that 12 weeks of leave. So you don't have to provide them 12 additional weeks if they've already taken some leave that qualifies. Just a reminder, the EFML is paid at 2/3 of the employee's regular rate of pay, and it has a maximum payout of $200 per day. The other 1/3 that the employee is not being paid, they can be allowed to use any available PTO that they have, or you can pay them if you want, but you're not required to do so. And just as a reminder that all other reasons under the Family Medical Leave Act are still considered unpaid. They did not change that to make them paid. So the fourth issue that I want to talk about is documentation and those tax credits that are available. So for the paid sick leave and the expanded family medical leave, for reasons that are due to school child care closures, employers may take advantage of the tax credits. When they're doing this, employers should require documentation from employees to back up the tax credit. And so in regards to paid sick leave, the employee should be giving obviously their name, the dates that they need to leave, the reason for their leave, and providing a statement that the employee is unable to work because of that specific reason. In addition to that, under the EFML, the employee should be asked to provide the child's name, the school or child care facility that they go to, and provide a statement that there's no other suitable person available for the child or to care for that child. So that's all the documentation that you can require an employee to provide you in these situations. When the child is anywhere between the ages of 14 and 18, you should also ask them to provide a statement that describes what special circumstances exist that require the employee to provide care. Because at that age, they should most likely be able to handle their schoolwork on their own without the parents' help. Just as a reminder, again, tax credits are available up to $200 per day on either of these, on the EPSL or the EFML. And tax credits are taken normally when the payroll is run. However, understanding that nonprofits don't always pay all the same taxes, the IRS allows them to file once quarterly for a tax refund for those monies. So, and then lastly, the last thing I just want to kind of do a little housekeeping and remind you, this went into effect April 1st. It is planned to sunset December 31st, so it only goes through the end of the year. If a business is closed or you have employees that you have had to lay off or put on furlough, the employee is not eligible for the EPSL or the EFML. However, if they return to work, and let's say their child, you bring them back and the child's school is still closed, they could then be eligible for that again through December 31st. And just the last thing that I want to bring up is, I know most of you are in Iowa, but if you do have employees in other states, that there are some emergency state and local laws that went into effect to provide some leave, as well as other states that already have paid leave that have expanded it for these purposes. So just be familiar with what those leave laws are so that you provide them. So, and with that, I'm going to throw it back. And
well,
what questions do we have?
Two super quick questions. Yeah, I saw a question come through the chat about that New York case that you mentioned at the beginning. So am I hearing you correctly that an employee's claim of the need is taken over the employer's claim, that it's not that's not possible? Or can you just restate what that New York case has?
So the New York case, there's a couple different things that they challenged on this law, and one of them happens to be whether or not the employer and employee must agree to intermittent leave in the case of when the child's away, and the decision was that the federal government overstepped their boundaries, and that the employee does not have to have the approval from the employer to take intermittent leave. So this, is still out to possibly be challenged. This was just, the decision was made on August 3rd. So we're still trying to gather information about that, but I just wanted to put that out there. If you're having intermittent leave, that I would be careful about, denying it from the employee if that's what their request is, and just look into that law.
Thank you so much. And then Sue, one more question. This is supposed to sunset at the end of the year. The academic year straddles 2020, 2021. Let's just say the second semester looks like first semester or worse. What do you see then if this is extended? They would get employees would get access to potentially an additional 12 weeks for 2021's calendar year at that point. Is that how that would work?
Again, potentially. This was all thrown out there so quickly. If you recall, we all started shutting down probably about mid-March. This went into effect April 1st, so it literally was passed overnight into law, and it's really hard to say. I agree this is likely going to go on way past December 31st, but in essence, again, it's 12 weeks that they're allowed. That's approximately 3 months. If they've used some of it already, they're probably not going to have a lot. So it's going to be a struggle for employees who need child care to gain that. So again, they're pushing if employees can work from home or have other work arrangements, to be flexible if you can with employees. But right now, the only requirement is that 12 weeks. And I don't know, it's really too early to say if they're going to expand that.
Right. Well, thank you so much for joining us from Colorado.
You're
we know
welcome.
You're on Mountain Time, Sue, so waking up with us this morning, really appreciate it. I'll invite folks. Feel free to ask questions in the chat. We'll let Sue go, and then I can follow up with her if there are some other questions that we don't have a chance to get asked. So thank you, Sue. Appreciate your time.
Thank you. Okay, thank you. Have a good day.
You too.
Bye-bye.
Bye. Next, I'm going to invite Kate Bennett and Cheryl to join us. In our breakout sessions, we'll kind of be exploring this topic from two different angles. And so one is really kind of what Sue was talking about, that employer angle. And then the other one is, you know, as service providers and offering programming, you know, how could this impact our organizations? So Kate, if you and Cheryl wanted to join us, I know your team has been really tracking, you know, what the different districts are doing as far as how they're opened or closed, or I hate to even use that term. What blend of options are available? Because I know and acknowledge that our schools are working really overtime to you know, to accommodate what's happening right now. So if you just wanted to share quickly an overview of what you're hearing and seeing, and then we'll move into the breakout rooms, hopefully around 9 o'clock. So go ahead and take it away, Kate. I don't know if I see it pulled up quite yet.
So I think we have a doc. Well, I can show my face, obviously. Hold on. Can you see me?
Yep, I can see you and I can hear you. Great.
Okay, because I can only see the agenda, so it's fine. Just tell me if I make a weird face or something. So what we know, obviously, yes, we've been working really hard to kind of wrap our arms around what is Return to Learn going to look like. For United Way of Central Iowa's purposes, we have Polk Warren, Dallas County, so that is 20 school districts. Obviously, Des Moines is the largest. They account for half of the population of the kids in the 3 counties. And then also many of the partners that we fund, you know, work directly with Des Moines. So what we have been doing is trying to figure out what can we do. You know, everything is so unknown. So a couple of things we've known that we can do is, one, create kind of an advocacy agenda. So I'm going to put a plug in for our advocacy officer, Dave, who is on the call. And when we break out, he will be sharing a document that we have put together with input from lots of partners that outlines some of the advocacy things that we've identified as potential enhancements to Return to Learn strategies, whether those are virtual or hybrid, and also, you know, what are things that we need to look out for. And then what Cheryl and I have been working on is just a moving target of putting together a grid that outlines what the districts are all doing. And we can get into this more in our breakout, but for those of you that might not be attending, I don't know, can we share that, Brianne?
Yeah, I think it should be in the folder. Barb is my awesome my awesome helper on the slide. So in the folder for today, it's named UWCI Return to Learn, I believe. So if we could pull up that Word document, that would give everybody an opportunity to see it. And my understanding, you know, you guys have done amazing work. Oop, that's not, I think, quite the right one. So we're in the August, yeah, UWCI Return to Learn August 4th down there. Oop, yep, there we go. Teamwork makes the dream work, as we say. That's perfect. So let's open that one up. And I think what I'm hearing and what we've discussed in some previous meetings is, and Barb, if we could open that Word doc, that would be great, is that you have collected all this information from a district level, and, you know, we're hoping to also have a sense of what programming is available from the nonprofit sector and kind of identify where those gaps are. So you've done an amazing job of mapping this out, and thanks, Barb, for pulling it up. And so we'll just kind of navigate through this for a couple of minutes, but part of the goal, I think, that you are hoping to accomplish in the breakout would be to share a little bit more. And we did hear yesterday that DMPS is having their partner meeting at 9 o'clock today. So, you know, it just so happens to coincide, and we're glad that that's happening. But some of you I know will probably be participating in that. So report back to us and let us know how that goes and what you learn.
Yeah, so you can see if we started it by county, and Cheryl, I'll kind of let you orient. You have the acronyms down, so do you want to talk a little bit about it?
Great, thanks, Kate. When you take a look, if you notice, RAN is return as normal. And then if you notice, the RWH is return with hybrid, and RCL is the remote continuous learning. As you scroll through there, I did check this morning, if you notice, Dallas, for example, and Adele DeSoto in Minburn, that was actually decided on August 3rd. And so I did peek at Dallas Center Grimes this morning, nothing up there yet. I'm going to kind of give an overview of some common threads that we currently see. No or limited visitors, and that is very specific, another common thread. Expected temperature checks prior to arrival, and that is falling upon the family, which also says without, for example, Tylenol. They're also talking about personal water bottles and turning off the water fountains. Also, another common thread that is seeming to emerge is to limit bus riding. As a matter of fact, if you notice at the very first school district, is that they're encouraging families to provide their own transportation. Again, which is quite interesting. Masks are expected on the buses, but again, when you talk about safety and social distancing, that's going to be very difficult to enforce on busing. Another one that is key with all of these is mandatory attendance versus in the spring of the year in the plans, it was in many districts, it was a hope and encouraging, an encouragement to attend. Another thing that we got a big question about is, tell me about sports and activities. And if you notice is that the Iowa High School associations, whether it's in theater, whether it's in music, whether it's in sports, is they are giving guidance. However, we want you to know is that that's also predicated upon local decisions based in what's happening in the health department. I also want you to know, someone asked in the chat, which is a great question, are they being reimbursed for transportation costs? I've not seen an answer to that. And right now it's really more of an encouragement because of the lack of insurance, is that they can set up social distancing on the buses. We also want you to know another common thread as we go through here, if we could scroll through there, is that an assurance, if it was on the website without going too far into any rabbit hole, is that they already have assurances about whether it's grab and go, whether it's curbside, which has also been cited that if, for example, your family does need food and is also doing remote continuous learning, there is that assurance. And the other big piece that I think we want to talk about is that this is varying by size of district as well as space allowed in their location. And currently, which is being right now quite highlighted in the news, it is currently being decided locally, and right now there's the struggle, which I know Kate might want to refer to, which is going on right now with new updated requirements coming out of state and Board of Education.
Thank you.
Want to keep scrolling through, it gives you just a little bit of a peek of what's going on. What I do want you to know is that there's a very common statement or phrase that's coming through there, is that families, please make sure that you have plans in place if we need to pivot, because this all has to be very flexible.
Cheryl, thank you so much for outlining this, for all the work that you've been putting into this. And we know, I see a few notes in the chat box asking for this chart, access to this chart. I know it's evolving on a daily, sometimes hourly basis. And so this is all captured at a specific point in time. What feedback do you have to those folks who are interested in kind of seeing this more holistically? Is there any availability, or should they work with United Way? What would be the best course of action in your opinion?
We have no problem sharing the chart. Just we can probably put a date on it that it's as of yesterday, or probably at midnight last night. Knowing Cheryl, she probably didn't rest until it was. But we can.
I think I got it at 11 in my inbox. So
we're happy to share it. It's nothing. It's all stuff that's pretty readily available. You know, in the public sector. So we're happy to share it with whatever's the best way. I don't know if that's through you, Brianne, or just individual people to comment in the chat who wants it, whatever.
Yeah, I think I'll probably be sending up a simple follow-up from today to participants and those registered. And then to Lynn's question about a return to normal school that has a COVID positive students, I would imagine that, you know, that's on a district by district kind of level, that decision of what the triggers are for closing or pivoting, as you mentioned, Kate. Do you have any clarity around that?
Cheryl would have more. I know from what I've seen just in the news, which you have probably seen, other states where they've already started school, you know, it appears they've been sending exposed people home for quarantine. I don't know if that's what we'll do in Iowa. Cheryl, I don't know if you have any answer on that.
Yeah, great question. Is that currently our governor has given us a very clear document that highlights the positivity rate and what should be done, and that is readily accessible on the website. Right now, we can say is that schools are still trying to digest that and make decisions. And again, if we know also is that it's brought about some controversy as well, as far as the positivity rate. But all of them in these plans, even before July 29th, have talked about, they have a process in place about contacting, isolating that student outside of the nurse's station, as well as then family members being asked to pick up that child within an hour to come and get them. And of course, now districts are trying to digest both new requirements or guidelines just released on July 29th with their space and location, as well as staff.
Thank you so much. So it feels like compassion and flexibility are maybe the name of the game here in Return to Learn. And
Right.
I know we're all going to be challenged as, you know, like I said, parents, service providers, managers, employers. I mean, this is really impacting our whole community. So I applaud everybody on this call for, you know, paying attention. And we're going to pull up the PowerPoint here and really kind of tee up our breakout rooms here in a second for this week. And I'll go ahead and invite Dave Stone, as I'm going to open up breakouts as an option. So for those of you who have been with us week after week, the way that we zoom you into breakout rooms is to indicate which one you want to be in. So we try and give you some choice in that regard. So I would encourage you to rename yourself. And you can look in the participants, find your name in the participants, click the blue More button, and then rename is in the dropdown. Rename yourself with the number of the breakout room that you want to be in. So Dave will be in the main room here talking about advocacy initiatives, and you don't need to indicate anything if you want to stay in the main room. You'll just default here. The main room will also be recorded, so that's a great opportunity for you to watch the follow-up if you can't be part of that and want to be part of the conversation. Room 2 is going to be the workforce impacts of Return to Learn. And so you'll put a 2 in front of your name if you are an employer who's kind of tracking and thinking about how Return to Learn will impact you there. So if you could take a minute, you know, you can keep your name and then just right in front put 1 or 2, and I'll start zooming folks out and assigning you to these rooms. Oh my gosh, y'all are so good. And we'll just give me a minute, and then while I'm doing that, Dave, if you wanted to maybe just unmute yourself and turn on your video if you haven't already. We'll give you the opportunity to just introduce yourself real quick.
Well, good morning, everyone. My name's Dave Stone. I'm Advocacy Officer for United Way of Central Iowa. And in addition to working on education issues, we also work on financial stability, health, and essential needs. But pretty much everything always ties back to a good, solid foundation in education for our youngest students. So before I go on further, I'll wait till we do the breakout.
Thank you. And I'm just getting ready to open those rooms. So looks like right now workforce is a little bit of a smaller room. But I hope you can come back with some great ideas. I know we had a kind of an initial brainstorm prompted by Nicole Beeman from Orchard Place last week, which was really helpful, I think, in just sort of thinking about how different organizations are handling this. So it looks like a great group, and we'll have some time after the breakouts to kind of reconvene and share some highlights from the discussion. So those of you who are in group 2, thank you, and just be ready to maybe nominate somebody to share that. So I'm just about ready to zoom us out. Thank you for your patience. This is my least favorite part, you guys. I hate keeping everybody waiting. And then let's see, I just saw Nicole in there, and we'll get you out. And we'll spend, let's say, about 15 to 20 minutes. I'll give you all a 2-minute warning before we come back. All right, I'm going to open the rooms, and then Dave, thanks. We'll pull up your information. All right, zooming them out. And then, did you want us to pull up that? Let's see, the advocacy document. You can share it. Okay, yeah, go ahead and share it. Barb, you might have to relinquish screen sharing to do that.
Yeah, 1 second.
Sure.
Okay, can you all see that document?
Yes, thank you.
Is it large enough? Can you read it?
I can read it, yeah.
Great. Well, so this is something that Kate, Bennett, and Cheryl, myself, and other community partners have been putting together during this interim period. Again, this is our focus.
Excuse me, Dave. Excuse me, Brianne. I've not been sent to a chat room. Could I please be sent? Sorry, Dave.
No problem, Cheryl.
I did assign you, but it says you haven't joined, so you might have a pop-up that you need to click to join. That's typically what happens. So check that out. Hopefully you can accept that pop-up, Cheryl, and get zoomed out. I wish I could see your screen and help you, but okay, let's see. Hopefully that works. Good.
Okay.
All right. I think we're ready to go ahead and start over. Thanks.
No problem. So as I mentioned, this has sort of been a collaborative document that we've been putting together focused on really a recovery, return to learn advocacy agenda in the education space. I think many of you are familiar that the education setting serves as so many roles for our kiddos and families, whether it be the educational component itself, actually time away from the home, mental and physical health, as well as developmental learning. And so there are a lot of reasons why we really wanted to focus on what happens when students don't go back to schools, because there's a lot of inputs that occur at there. So I'm just going to jump right into this list here. Our first one, and is something that we've been working on for about 3 years now, is really focusing on nutritional and health needs of our students. The education setting through free and reduced price lunch provides regular meals for low-income students, but also many of our community partners and our school districts provide take-home meals for those students, whether it be a backpack at the weekend that provides subsistence for the student as well as the family over the weekend. You know, that meal distribution is critically important. We have a food insecurity problem in central Iowa and really across the state. Schools serve as the best place to get hungry kids fed. And so we do need to look at and continue to figure out how do we get meals and food distributed in a virtual setting. Health and developmental screenings, vision, hearing, dental, mental, and physical health. This is one that has been, unfortunately, a controversial issue in the past 3 years within our legislative work. Many school boards would like to eliminate some of these developmental and health screenings as requirements of schools. So for the past 3 years, we have been holding the line on making sure that both school nurses, parents, and community partners can still make sure that those kiddos are healthy and safe. Every year, this year, with the weird short truncated session, we did not have as bad of an attack in terms of health and developmental screenings, so they are still allowed. But in years past, it has gone from the gamut from reducing the burden on schools to be able to provide those, to throwing everything out with the bathwater and saying no more health screenings at all. And so this is a critically important one. I always like to talk about vision. Vision is one that kind of cuts across all income levels. For many kiddos before the age of 9, they aren't really able to express that I have vision problems. I can't read the whiteboard. I can't see the screen. They just don't know differently. They've lived their entire lives in a blur. And any of you who wear contacts or glasses, you know, take them out. You know, we know the difference. But if that's how the only thing you've known, you know, that's critically important. Vision screenings are conducted in most of our school districts, either through just a quick check with a school nurse, or with our Vision to Learn program, in which we send a qualified ophthalmologist to the schools in a mobile van, do a screening of all of a cohort of students, identify those who have vision problems, and then provide them not 1 but 2 free pairs of glasses so that they can see. It makes perfect sense why we care about this, because it's really hard to learn to read if you can't read. So, you know, those are one of the things that we really need to focus on. Another area is school supplies. You know, parents try their best, but as any of you with young children these days, that school supply list is getting longer and longer, and getting ready to return to school can be expensive. And so United Way and other community partners do provide school supplies as needed to students. And then a lot of kids receive health and mental health services within our schools. Our schools really are the epicenter of the children's mental health system. We don't really have a system. We're kind of patchwork in that regard. And so a lot of students receive mental health therapy while they're in class. Partly it's to provide privacy for the student if they're having an abuse situation at home. Maybe a parent or a caretaker is the abuser. They have a separation. They have the privacy needed in order to have those conversations. And then also, you know, if the parent or caretaker isn't willing to provide those services, it's a way to get those access. So one of the things that we'll be looking at is how do we, if visitors can't come to the school, such as a therapist, how will we continue to ensure that those students receive the mental and health services that they need if a provider can't go to the school? There is some, this is a key advocacy point in which private insurance most likely will cover virtual visits, telehealth, what have you, or a non-traditional environment. But for our lowest income populations, Medicaid, it's unclear at this time if they will cover those types of services outside of the traditional school setting. So we're working on that. Any questions there before I move on? All right. Child care assistance, as you all know, is something that United Way has worked on for close to 20 years now. I believe 19 years we've been working on it. And child care assistance, of course, is incredibly important right now, more than ever, for our lowest income families, but really child care across the board is a key support for work. In this strange environment in which some folks are furloughed, some folks are laid off, some folks are working from home, and some folks are going back to the office. If schools are not in session, childcare becomes a critical, important part of being ready to go back to work. We have done a lot of work on childcare in the interim. For your knowledge, as of July 1st, 2020, a new rule has gone into effect in the state of Iowa, expanding the child care assistance program to include families up to 225% of the federal poverty level. That's huge. We're very appreciative of that. That's been something we've been advocating for years. However, we're not done because if you recall, there's traditionally a cutoff of 145% of poverty. For a family of 4, that's just under $39,000 a year. A family who is eligible can stay on the program through 225% of poverty. However, if you're at 150 or 155, you are no longer, or you are not eligible to join the program through this new rule change. So unfortunately, we have had a bit of a donut created, and that's one of the areas in which we're going to have to continue to address in order to make sure that every family across the spectrum can be covered. Okay, I need to move up a little faster here. One of the other
You're
things
fine,
we're doing,
Dave. When you said that before and you likened it to the donut, I said, you know, like that's the only donut that I would I would not accept, the only unacceptable donut. And I did want to call out with that also, we'll have a note in kind of the what's next slide when we call everybody back about the DHS call at 10.
Right.
And so if you have an opportunity to pop any of that information into the chat when we're back, if you want to open that up more broadly and say,
Sure.
you know, take a break and join us at 10, that would be fine, and I'm sure some would appreciate joining that.
So briefly, just to wrap up CCA here, we are looking to have 2 units covered for those who are not in school to help provide stability to the provider market, as well as making sure that students have access to care. Really focus on out of school time, OST is that acronym, in distance learning, you know, what kind of technical assistance is necessary, how do we bridge that virtual divide. Moving on, Wi-Fi or broadband access has become an advocacy issue that United Way of Central Iowa is looking at very carefully. It hits so many things from just our pre-K through 12 system, but also continuing education students, as well as adult learners, and of course, folks like us who are working from home. And we do have a really inequitable broadband system in our state. I mean, I have coworkers who live 15 minutes south of Des Moines who don't have good internet access and can't do sort of things like this, such as video calls. So broadband is incredibly important. Equipment quality. In a virtual environment, students need to have a good, decent laptop, Chromebook, or access to one of those options in order to continue their education. This is a simple one that we can work on in partnership with our schools, our donors, our partners, and across the community. Let's get some laptops and Chromebooks into the hands of kiddos who need them in order to continue their learning. And finally, empowering those student learning through that using technology. How do we support flexible programming? We've already had some flexible options in our pre-K through 12 system. Now that we're kind of truncating into a virtual / in-person hybrid model, how do we continue those flexible options for students who may be non-traditional students, who may have a flexible schedule, or who are pursuing other avenues outside of the traditional school setting. So that's just a brief run through of our advocacy agenda under education for pre-K through 12 and return to learn. I'll stop there for comments and discussion.
And I'll monitor the chat box in case any of those come in, or feel free to turn on your video or audio if you wanted to share more. I did want to ask or note, I was in conversation last week with an affordable housing kind of case manager, and they had an idea in their community to sort of do some train the trainer with families on how to navigate the virtual campus kind of systems, and hoping that they could teach one who could teach a neighbor, and so thinking about different partnerships like that might be helpful too for those of you on the phone who are in more of that kind of a role. Dave, what can we do? I guess that's my big question is, you've put together some really great opportunities for, or you've highlighted some needs. And so what are the opportunities for us as a nonprofit sector to join you in this advocacy?
Well, there's sort of the boots on the ground element first and foremost. What can your nonprofit, what can your organization actually do to serve some of these issues? A great one, as I mentioned, is the technology component. Do you have the ability to provide funding, actual laptops, Chromebooks, or work with your partners in order to do that sort of thing? So there's the actual direct service, let's get some things in hands. If you're a health provider, a mental health provider, please take the time to think about how do we provide these necessary and critical services in a potentially virtual situation, if you have not already. Those are a few things. Secondly, as we move into legislative session in the fall winter, working with the governor, your voice and your advocacy is incredibly important this upcoming session, as we don't quite know yet if in-person advocacy is going to be a possibility. So reaching out to your local legislator, explaining the situation, testimonials and stories about what's occurring, reaching out to the governor, and when we have opportunities, we will of course share those with the community as well to make those sort of reach outs. We won't necessarily have traditional lobby days and things like that this next session, as that is currently closed down for the session. It hasn't been decided whether or not we will have large-scale gatherings at the Capitol. So really having a good, strong relationship with your legislator first and foremost, and constantly reaching out, whether it be by phone or email. Email's been a little difficult. I would say it's better to actually call them at this point, just because they're probably under a deluge of inbox, like many of us, and so things have been slow to uptick. I'm just going to check the chat here. Sent a personal note to the governor's office regarding the need for high-speed internet. Yep. We are working in a coalition with some business partners, as well as our Skills to Compete coalition, to really focus on how do we access broadband equity across the state, look for further information there. There have been funds dedicated to it in the past. We just need to really buckle down and really focus on this now. Value doing a laptop drive, they're old laptops. Old laptops can become a problem in terms of, are they functional? Do they need to be cleaned? Privacy concerns. And so as my IT department, I can hear their heartburn already. That is a difficult thing. Gently used, slightly used is okay. Corporate partners who have a full-blown IT department who may be switching out a whole department's computers, they usually have the procedures and process to wipe it clean, get it set up. There's a lot of issues there. Preferably new, gently used. The older laptops just become fodder for recycling, unfortunately, at a certain point. Other questions, comments?
These are great, thank you. And I wanted to let you guys know I am opening back up or closing the breakout room. So it looks like folks are still finishing up conversations for about 2 more minutes, but we'll be able to include this in our follow-up, Dave. And then if others have questions, we can go ahead and direct those to you. Let's bring back up our PowerPoint, Barb. Thank you so much for doing that. Perfect. And I did want to make some announcements and updates. I'm going to give another minute for these rooms to close because it looks like there is vibrant discussion happening. That's always kind of exciting for me when I give people 120 seconds and they can't stop talking. That makes me feel like we've had some good breakout experiences. So I'm looking forward to learning more. Oh, I did see a question here. Dave, do you know anything about the second wave of CARES funding?
Yes, I was just typing a response.
Oh, okay.
So, you know, we do head into federal recess here shortly. My indication is that the second wave, the next stimulus package is going to be delayed. We had originally heard late August, but no decisions have been made at this time. Many of the, as I call them, Cinderella measures from the CARES Act funding, Part 1 for childcare, things like that, a lot of that has not been spent yet. So they do have some available funding at the state level still to distribute. Second CARES Act, again, delayed. We're looking at late August, early September at the earliest at this point, unless things change here in the next few hours.
I know that's what's so great about this as a partnership is that everybody's kind of got their ears open for different opportunities. And one thing I wanted to note is I reached out to Dustin Miller, who helped us kick off our nonprofit Ask Line and some of our community circle conversations. And he's also monitoring the HEALS Act, I believe, might have some implications for unemployment for the sector. And so, you know, anything that we're hearing, our goal is really to get that information out to you. So hopefully you're all subscribed to the Community Foundation's nonprofit link newsletters. We've been sending those out weekly, but we're moving to twice a month with those as well, and following us on social where we try and get this information out as soon as possible. So as we wrap up, I wanted to make a couple of announcements and provide some updates. Many of you likely saw that the Iowa Nonprofit Recovery Fund was announced through the IEDA. And speaking of Dustin Miller, we kind of checked in with him on some, you know, recommendations, and you'll look at those priorities and you might be, you know, bigger than a 25, what was it, a 25-person organization, or you might not feel like you fit the priorities as an organization, but we're trying to make sure that you note the limitations and that you might not be eligible now, but it doesn't hurt to get in the queue in case they change priorities. So what I've heard is that, you know, this has been maybe less painful than the PPP process. And so to get in the queue would be important to see what sort of funding might be available. So check out the information on that grant program. And then I also wanted to highlight our strategic collaboration grants. We have information on our website about those. And we will be doing our first round of reviews this week, but we'll have another round opening up in September. And so talk to me if you have some more questions. Okay, and I see the childcare overview with DHS. Let's go to the next slide. And Dave, I got some feedback that maybe that meeting isn't as open as we thought it was. So, you know, if folks are interested in joining that, maybe if you want to get in touch with Dave or United Way, otherwise, you know, they're kind of monitoring with DHS what additional opportunities might be available. And so I also just looking ahead as we close out.
Hey, Brianne, this is Kate.
Yeah.
Can I just interject something really quickly?
Yeah, please.
If you're not able to, or Dave won't let you join the DHS call, one thing we heard, and I have no idea if this is true, was that DHS is allowing for 2 units for parents that already have kids that are qualified. All that parents need to simply contact DHS and say, hey, I need 2 units. Again, maybe that won't really work as smoothly, but that would be a first step. So if any of you have kids you're already serving that are on DHS for summer or after school, have them contact DHS and ask for 2 units if you know you need them.
Great. Well, and Kate, while you're unmuted, you were in the room number 1. So as we're wrapping up here, do you have any big takeaways from that or a request to the group as a whole? And then I'll give somebody from group 2, if anybody can just let us know some of your takeaways, or Nicole, if you can maybe share those with me, if there is anything we can send out in our follow-up, some good ideas that employers have. So Kate, is there anything?
Say our biggest takeaway is we know that no matter what Return to Learn looks like, there are going to be lots of families that are going to be left behind. And how do we reach out to those? How do we kind of cut through the fighting about what model and figure out, okay, no matter what the model looks like, how do we find and serve the people that aren't going to be able to access either because of transportation or technology, and begin to serve those. And that's most likely through our community partners that already have connections to these families.
Mm-hmm.
So,
Thank you.
Yeah.
Thank you. That's perfect. And Dave, in our previous call, you talked about the power of having those stories also around advocacy and, sharing some of what we're seeing on the ground. If you wanted to just share a little bit about that.
Sure. One of the things that are so powerful are the voices of the folks that we serve, those testimonials. So during this time frame, if you do come across a client, a family that you're working with, please ask them if they'd be willing to share their story. It's better if you already have a testimonial form or an authorization form to get them to sign. We always have need at the Capitol or with our elected officials to share real world stories. We can have one-on-one meetings between a family and a legislator to really share that. But then also there's the media aspect as well. I don't know if many of you probably get a call from the Register or one of the other media outlets who are looking for a family that's, in a situation. So right now, more than ever, testimonials and collecting those stories are important. We like anonymous stories are okay. Of course, it's always better if we can put a name and a face to the real issue.
Well, thank you. Yeah, I think today was all about just looking at how the nonprofit sector can respond, and that's a great call to action that all of us can be engaged in. For those of you who were in the workforce, thank you, Nicole, you're reading my mind. She just added in the chat box some takeaways. So I'd invite everybody as we're closing today, if your organization has an opportunity coming up or you wanted to share some information that you didn't get to share, please go ahead and leave it in the chat. I'll check that and follow up if need be. And then Nicole did include information about flexible work schedules, understanding the scope within your employee needs base. So having those conversations now, even though things are uncertain, I know, a lot of parents are experiencing a lot of anxiety. Just being able to talk through possible scenarios with your employer is a huge benefit. So consider talking with employees to see if the group can get together to address support and school needs. You'll hear maybe in the background, my child is crying. So this is kind of the era we're in right now. And I appreciate you all being with us today. Please include information in the chat, and we'll see you on August 19th. Feel free to invite others from your organizations to participate as well. So thank you again. I'll keep this open, but turn my video off while I give people a chance to post in the chat. Have a wonderful rest of your day.